It's 3 p.m. to 5 p.m. local time. 7:12 the Universal Library Biological Sciences Auditorium. We'd like to leave this meeting now for welcome remarks. And it's going to be done by the pastor of the Universal Library Biological Sciences. It's also one of the principal investigators of the Green Project, Dr. Bernie C.
Good afternoon, everyone. I will start with welcome by telling you a story. A few years ago, when I went to the Ministry of Health as a medical officer, my first week in office, the Ministry of Health had conducted a polio campaign that was sponsored by UNICEF. We had made a financial report, sent it to UNICEF, and then UNICEF sent the whole financial report back. And that was because when you look at that time, of course, everything in the health sector. So the nurses, midwives, physician assistants, and doctors did the financial report. And the financial report went to accountants, and they did not accept the report because it was not the way it was supposed to be done. We have to bear UNICEF to support us to go back to the 15 counties to correct the financial reports. But we started when we were designing the program, the vision program, and this idea came about. I was wondering what we were going to do with it. I just couldn't figure out what they were talking about. And I believe today, many of my colleagues on this campus and in the hospitals are also thinking, not only they will ask me what is actually happening on that campus. Because this campus has, over the years, trained doctors, pharmacists, and we are adding on. And what we know is people should go in the clinic and work, or in the hospital and work. And so, it is difficult to really think that we can do other things. Over the years, if you look at the way health workers work in this country, even in the private sector, you will notice that it will be maybe a midwife who on an extra income will open for delivery facility. It will be a small facility with one person doing deliveries. It was always tied to our profession within the health sector. I've sat down here this afternoon and I've listened to 15 different innovative projects. What strikes me most is that all those presentations are young people. And I'm very impressed with that. Because we are building this country, and we continue to say the government should provide job opportunities for young people. But we have demonstrated that young people can actually think and make the job opportunities for themselves. And that's what I saw here this afternoon. I'm also very much impressed with the context of the different projects and the way you are trying to solve a good bit of the problems that we have within the health sector. I would like to encourage each and every one of you. I know that some of these projects will be selected and supported, but that's not the end of it. Maybe those of us who also work within the sector and see some of these good projects, if we can have supported through this, we can also link you to other people who can look at this for you. So we'd like to say thank you to those who brought up the idea, those of you who have thought through these different projects, and will be able to carry the power to solve the problems we have in the health sector. We'd like to welcome all of you to this session, a closing session, and we look forward to continuing with you forward. Thank you.
Thank you, Dr. Dunn. I really just want to do a clap for yourself too. There's three amazing statements for you, and I feel that your clients can be proud to say you've done a good job in spite of your presentations being reviewed and scored and all that. I'm not going to redo Dr. Dunn's particular remarks, but this whole innovation and entrepreneurship planning started out being a bit selfish, but took scores, of our, this whole innovation and entrepreneurship planning took scores of our strategizing, planning, measuring, anticipated success and results and all of that. So at this point in time, I know many people might consider that some little part of the program. I respect that. I just let you use this time as the MC. That's a good thing of being an MC. You can inject and you can eject. So I'm injecting an opportunity to recognize those that have been working on the entrepreneurship and innovation component of the video project. If you here just stand, I want to say thank you to you. All those working with the Healr program or work on the Healr program, let me put it that way. Do I need to call them Sam Influencer, Lala, Albert? I'm sorry, I'm sorry. Maxwell, Joseph. That's why I say on the team. That's why I said on the team. So you guys just stand. So thank you, gentlemen. We stand here to celebrate hours of planning, research, thinking that we put into this program. So I just say thank you for that. We're about to have a special presentation, and this is going to cover the overview of the Ideation Course. It's going to be a 3-man presentation. Our woman's going to be there anyway. So we have Dr. Dave McLean. She's the Deputy Director for the CTL, that's the Center for Teaching, Learning, and Innovation. We have Mr. Bennett, who's our lead facilitator for the Ideation Course. And of course, we have Mr. David Lama, but I think the Mel team has some representatives there. But you guys here, you're up.
Well. Good evening, everybody. I'm excited because it's been a long. Yeah. We started October 3rd. But let me let you know that before we started, the team had done a lot of background work. And so you came in October 3rd. And here we have the not knowing that we could have reached this stage. We worry sometimes I will get up in the morning and say, I need to be on the campus Friday, Monday, Wednesday, Friday. And here we are today, we need to celebrate ourselves. While we still going on, we have some powerful team. Powerful people that came from diverse entities that came from. We have a diversity in our group. We have ALA, we have the senior team, we have the CHS team, and we have this high joy. One person that just joined us, Lala. Let's give all a hand for Lala has been so helpful. Lala, we must for you. Thank you so much for the help. Yes, we couldn't have reached this far if you are not there with us. So we say thank you so much. We are only taking all this time because we are trying to set up our presentation. And even though we are not trying to say thank you to a lot of people, but in their team, sometimes they are angry with them. Monitoring is part of the job. We think that they are trying to force all the 70s, all the things that we want them to hold, they want us to hold their way. But sometimes we don't want to say that. This is why the program calls for. And they were there to help us. And this was great. Thank you so much for the helping. here today, the communication team was able to produce them for us. Our participants, they're wonderful. I mean, this program would have been successful if you had not been here. If you had not taken up your student every morning,
we're looking to see these businesses start. Very important. This business has to get started. All right. And we're here to provide that support, that mentorship, that coaching, that big technical or financial, we are in the space to do that. Right? So I'll pass it on to Doc, and then you'll see me soon.
thank you so much. So this evening, we just want to let you know that the innovation or the health innovation and entrepreneurship program at the University of Liberia composed of different team members. And as you look there, you see team members from ALAB, you see team members from the CIMATE, you see team members from ULCHS. That's it. Okay, so we have the Center for Teaching, Learning and Innovation. And this center, we say, is a national public-private academic hub. And its aim is for training and collaboration throughout the Liberia Health Sector. So we are not only talking about the College of Health Sciences, we are talking about the Liberia's health sector. So the CTR are composed of different activities. These are the activities, faculty development, Excel, and so on. But today we are here for the health innovation and entrepreneurship activity. So we have programs that were able to inform us. And there were different landscape of analysis that we've done, regional, Liberia-wise, and so on. we did some collaboration, and that collaboration was with ALAB, Liberia, and CIMA team, and we continue to do those collaborations. And there was some scoping assessment that we did as a team, because to get ourselves to this point today, we needed to also research. We wanted to know what others have done. We wanted to know what the innovation space was in Liberia as well. So we needed as a team to make sure to research, and this is what we did. And in Liberia landscape, we were able to see that there was lack of access to financing. We saw business skills lacking. We saw cultural and structural support for interest and entrepreneurship also lacking. So we thought it was, as a team, we can't keep ourselves just Liberia. We wanted to make some outside travel as well. And so we did that to Ghana and Kenya. And there were some things we were able to see in Kenya and other places, or Ghana. We were able to see that entrepreneurship was mostly into the private sector. Those are things that we were able to see. So we came back as a team. What can we do? We found out enough. So we sat down together as a team. After our seminar, we did a seminar when the CTR had a launch in July of this year. And we found out that when we had the seminar, we had about 199 attendees. And then we had other people as well who were on other website and watching this program. So we had lectures, hours, or office hours that also came about. And we have what's in a startup business plan. It was taught by our learned team from CIMA. We have business economics for young startups, and we have defining user needs and value proposition. These were the topics that were taught in our seminar. So then, after that, we set up a link, because after our seminar, we wanted now to start what we call our Healr, which is health entrepreneurship, advancement, leveraging research. And I will always, every time I'm presenting, I want to give the credit to Nicole. She was one of the partners working with us then. So we struggled. Let me just give you a little history. We struggled over the name. What name can we get for this program? And then we came up with something called PEP. And then later on, Dada say, "Is that? Are you sure?" When we talk about PEP, when we look in the health sector, we will see that PEP represents something else. So we had to struggle over the time. And one day, while having our meeting, Nicole from Yale University just came up, and she just brought this name, and it fit so perfectly down for us. So we are glad, even though she's not with the team today, but we are glad that we have this name. So then we came up and sat as a team. Let's start something, because we've done our scoping assessment. So we started our ideation, where we started in October of this year, and we know that it's gone for 3 months, and for which we are here today for the closing. And then we have another stage that we'll go to soon. That is creation. You did your presentation, like we said, and some of us will be opportune to go to creation. But we have always said that don't be discouraged if you can't get to creation, because you know that there are people who listen to you today. Remember when Dada Dan was speaking, she was so thrilled by all your presentation. So you are super proud of yourself that you can come this far. Then we will have our implementation. So it is a training, and during the creation, we're going to have mentorship programs that will continue to go on. Even in our implementation, as we go along, we will have mentorship. We are thinking about where our maybe graduates, we will form network of graduates or entrepreneurs from this Healr program who will come together to also serve as mentors when the program continues in our implementation phase. So then we said that we started this in October. Orientation program was in September, and we had 10 weeks of classes, 3 times a week, Monday, Wednesdays, Fridays. We have 3 wonderful facilitators, 30 participants, and today we are going to be having this amount, 24 that are successful, to have their certificates given to them. And we are excited that you are all here today to receive a certificate. And you look there, that picture shows how serious our participants are. And we have wonderful facilitators who've been working them out continuously so that we can reach this far. And so the next thing we are thinking about from January of next year to June is what we're going to be talking about, our creation. So we've had our presentation today, and that presentation is because we want to get people to creation. So we are thinking about having approximately 5 ventures that will be selected from this presentation today where we can get to our creation. And the course will be launched in January, like we've said, and it's going to be intensive. It's going to be intensive. So listen very well. Those of you who will be successful, remember that it's going to be very, very intensive. It's going to be a didactic a learning program where we're going to have mentorship sessions, 8 hours per week. You are going to be committing yourself to that. It's going to be led by the CIMA team. And then we're going to have other additional mentors who are experts into this as well, who are going to be part of this team. So the CTR will be creating dedicated space. Right now, we have a dedicated space that participants will be able to sit so that we can have a smooth running of this program. Then we know that we must have what the essence of macro, what the essence of creation if we are not going to be going forward with macro grants is going to be available for successful ventures that will be presenting clear, articulate business ideas at the end of this. Today, you are not going to be receiving any macro grants. But after creation, during your presentation, we expect that you will be all heroes and you will be standing up and doing very great presentations that will lead us to giving you some finances that can help improve your business. So thank you. We will call our facilitator for this presentation.
Thank you very much, Dr. McLean. Thank you. Good afternoon again. My name is William Dennis, and I was the lead facilitator for the Ideation Course. And I'm very happy that this experience with the participants, as you see them, all right, kind of added value to their already ideas and businesses that they had during this course. So the course exposed the participants to entrepreneurship, okay, and to kind of understand what are the components that they need to go through to be able to get those ideas off the ground. All right, and so we look at several courses in a package, entrepreneurship mindset, types of entrepreneur, for them to understand who they are when it comes to entrepreneurs. Who are they? The different kinds of entrepreneurs in the world. And so you needed to identify who you are. And we also look at business and financial planning. Now, it's essential to understand that these ventures, as they get off the ground, they need to understand the basics of how they plan and financial planning as well. You know, as money will be coming into the business, they need to understand how to plan for that. So we did that, and also look at healthcare marketing, effective leadership, building teams, and the interesting one was our street combing exercise. All right, this exercise helped our participants to go out and identify potential ideas. We called it a hay and click exercise. First time doing like girl, by the way. First time doing like girl. All right, first time doing like girl. First time. And only us that did that. All right? Good. Next slide, please. So our methodology, obviously, as a certified trainer, is a combination of a lot of things. Looks at group exercise, presentation, case studies, and what have you that each participant had to go under. All right? We needed to ensure that each of our participants needed to actively engage in the presentation of the course. And so we did several things like the group exercise and they had to come on stage to present a project, or they had to present something, which is the learning, because we want to make sure as entrepreneurs, and as you see that they came and presented the business, they need to do that. This is going to happen every time, they have the opportunity to talk about the ventures. All right. So as Dr. McLean also mentioned, we had 24 sessions, 3 times a week, with Monday, Wednesday, and Friday for 2 hours. And so that's really intensive. And it was very interesting to see that, they were committed to coming to the training. All right. They were also very interactive, and they learn a lot. So obviously, I'm the lead facilitator and got several certification from different organizations. I'm also happy to present Mr. Daniel Maxwell Jr., my co-facilitator, also very experienced for over 12 years doing business development in this country. So combined knowledge and skill is over 20 years, guys. It's over 20 years of doing this work. And we utilize the IFC, which is the International Finance Corporation Business Edge. We also have another partner called BIT, which is Business in Development Network. It's a certified Dutch BDS firm. And then the International Youth Foundation and Microsoft, which build a package called Build Your Business. So it's the combination of these 3 packages that we utilize for the training course. Okay? Good. So also, acquire knowledge and skills and attitude, look at effective communication. Now, it's essential that our participants and entrepreneurs know how to effectively communicate. Also, self-awareness, creative problem solutions, and adapting to change. Those are also things that they acquire during the time. And also, looking at how to turn problems into opportunities. Now, one of the things that we learn is how entrepreneurs spark problems, but we don't really call them problems. We call them opportunities. So they are able now to identify opportunities and transform them into ideas that eventually get started into a business. Guys, let's give a hands for these guys, man. Incredible people here. Please, 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 please. Right, great. So again, generate a new business idea, which we saw in doing the street combing. They all had the chance to identify business ideas, all right, and present it to us. So again, a lot of ideas can come out of these guys, not beside the one they just presented for the program, but they have creative way of identifying ideas that eventually can get started into businesses. So build and lead effective teams and forge meaningful partnership. They also learn how to do that. Great. Next, please. So data. Oh no, this is MA. No, this is MA. You're missing one of my slides, Jenny. Oh. Anyway, this is for MAE. So thank you. We'll turn it to the MAE people. Thank you. Thank you.
Hi, everyone. Thank you, Dennis, for that nice presentation. And I'd like to say thank you for everyone that supported this program. I'm really impressed myself. I was just sitting there looking at you guys. We got a couple of times I used to come there. But I'm sitting in for David. You used to see David around a lot more than me. So I just like to say thank you for your time, your effort. I wish you all the best. And thanks to our director. Thank you, Dada Dan. And thanks to everyone that put their effort in making this impact that we all have today. So basically, the insight or the data insight for this project, when we started off, we had a diverse cohort that had like 50% female participation and like 48% male participation. So you can see the gender, there was not much of a disparity between the two. So that's impressive as well. Then with participant experience, I think you will be thinking that all these people that presented here, they were schooled in business school or not, but most of them does not have a business. That's like 55% of them. So they did well within 3 months to do that beautiful presentation with business ideas. So So people that had some level of business experience were like 45% of them that somehow own their own businesses. But I know some of them that was the first time they had to express that in public. So that was impressive. So we can move on to the next slide. Yeah, so you'll be wondering if whether these people learned something during the period and how do we show that to you. So we track some of the questions that were given in the pre and post test sessions. So they have a couple of sessions. So at the beginning of each week, they had a pre-test that were given. Then afterwards, they'll do a post-test to test whether there was knowledge gain or not. So we just decided to show some of that just for you to see in real time what was happening. So at the beginning, participants were asked how well do they know their entrepreneurial characteristics. So many of them say, yeah, we know, but some of them say somehow I don't really know. That was the first week. So people are not really confident. So in doing the post test, you can see that somehow normal kind of drop a little bit. And people who feel confident that they know what their entrepreneurial characteristic are or is, they were more than those who said at that time they didn't have that idea. So you can see there is a change in their perspective when it comes to what characteristic entrepreneurs carry. So we can go on to the next one. So basically, that's the end. We had a lot to prove that these people attended this program, and the completion rate was really high. Maybe we'll never cover it up on the slide because of time. So thank you all, and it was great meeting you again.
Thank you. Thank you. Thank you.
For us, innovation at Bridge is where we are generating new ideas and translating new ideas into products that can be utilized, especially in the health delivery. For us, innovation at Bridge is where we are generating new ideas and translating new ideas into products that can be utilized, especially in the health delivery system of Liberia. We are hoping that these ideas within the health system will be a very vital one that is going to be used in the health delivery system of our country so that Liberia can be a better place.
One of the reasons why grants hasn't really been a success, we realize in this particular ecosystem in the country has been because forward schooling and lectures have been given to participants or beneficiaries after the grant has been given. So we decided to create a reverse of the entire situation. We provide a training prior to the seed funding. And I think it's working pretty well because it's interesting to know that some of the participants have a change of idea, change of thoughts, and what they thought would have been a business had rather been something else. So this ideation phase is very key because the sifting process that leads from ideation and creation means that we have the best candidates in the creation process. And obviously, we do believe that the sifting process that will go on from creation to implementation will obviously be the best as well.
I'm grateful for the opportunity of being here. Coming here have enlightened my understanding as a faculty member. Initially, you just think, okay, go to school, learn, excel in your profession. But coming here to the class helped me to see entrepreneurship to be part of my life. Knowledge gained from these courses have enlightened my understanding, so we are working towards adding
entrepreneurship into the curriculum for nursing and midwifery students so that they will be able to not just rely on seeking jobs, but they themselves can provide jobs and be employers for other people.
So we have a combination of entrepreneurship and business skills and employability skills or soft skills. As a key takeaway for the participants is that every participant in this course have learned, understood what entrepreneurship is, look at the component of business management, doing marketing study, providing good customer service, and doing financial management. With the handouts that we provided, they will continue to read that and they will continue to enlighten their mind as they engage the real market. So we're very happy and excited that we're able to facilitate this course, although we haven't concluded yet. There's additional materials that's still yet to come, but at this level, we're very happy and excited that the knowledge has been gained over time from the interaction and the different assignments and group lessons they have participated in. We can surely measure the performance over time.
Hi, my name is Ahmed Kekone. I am a founder of Jara Pharma. Having gone through the program, I now realize that there are specific things that I need to do as a founder of this company in terms of business development and actually learning and the different things that you have to do that takes an idea from just an idea stage to like the implementation stage. So part of the course has really taught me how to stay long with my idea and the different processes of idea creation. Other than that, I've also learned how to, manage a business from a ground up. And in addition to just managing the business, I now know how I should be able to manage my finance or how to communicate with a customer, for instance, because that's also very important in running a successful startup, such as the Jara Pharma that we're about to create. So in terms of what I'm looking forward to, like I said to one of the facilitators before, this training for me it's a stepping stone to launching this company that I think will revolutionize or reimagine how pharmacy is served in Liberia, which falls directly within the healthcare space. So I'm looking really forward to launching this company through the Bridge Liberia project. And it's really been an honor coming to this class every other time to just touch base on what entrepreneurship in terms of how to lead a successful entrepreneurial venture.
going to have problems. So everybody here, I'm sure before you reach this point, it's not a formal oath like the Hippocratic oath, but you have decided and understood that it's a business that you're starting, and not an NGO or a charity that you're starting. Now, as a health entrepreneur, you are focusing on two things, which are mainly one thing: improving health. Improving health, and doing that by using market strategies. Okay? Never forget that your number one goal is that improving health, right? And never forget that because you have established a business and not a charity, you need to respect and understand market strategies. I didn't go to business school. I would be the first one to admit and I went to business school, not do I intend to go to business school. The amount of school I've done, I find it sufficient. But I will continue to learn into perpetuity forever and ever. Not only because I'm a doctor, and you have to continue learning because science continues to evolve, but also as a business person, you have to learn your business. You have to learn what it takes to run that business well. You have to learn who you are serving and how to. So I will continue to learn, but prayerfully, not in a structured classroom again. Okay, but it is important that you remember this. Your number one goal is that health. I want to talk a little bit about social impact in general before I move into health entrepreneurship. The concept of social impact businesses mostly are businesses that support what we call the SDGs, Sustainable Development Goals, which were established by the UN in 2015, goals that they would like to see to make a better world by 2030. I'm not going to go through all of them. There are 16 of them. It's too much. But there are some specifically that impact health. The number one that impacts health is SDG number 3, which is health and well-being. But there are others, what we call non-medical determinants of health, that are also very important. And I was not here, unfortunately, to hear all of the pitches, but I suspect that some of your businesses are in the non-medical determinants of health, which still make them, a health enterprise. Zero poverty. SDG number 1 is zero poverty. I don't even think I have to explain how if you're poor, your health will be impacted. I think you all understand that already. 2, no hunger. Hunger, nutrition, all directly impact health. Clean water and sanitation, SDG number 6. We all know how that also impacts health. The number of typhoid in the country, we know how it impacts health, right? So what is also important to understand about health, when I'm adding all of these things into health entrepreneurship, is that health does not just mean the absence of sickness. It means overall good well-being. For example, your iron level can be low, and your blood level is not yet impacted, but your iron level is low. Technically, you are not sick. Your blood level is not low. But you continue going, you will reach the sickness level, right? So the idea of health is to keep people in a total state of well-being so that they remain healthy and to prevent sickness. It doesn't just mean at this time I don't have sickness, because they won't go into sickness. Okay, so that idea of health, we talk about things like clean water, we talk about things like adequate nutrition, all of those things are all things that could be health enterprises. Okay, and could be branches of your businesses that you haven't thought of yet, but just keep in mind there's wider things to do around health. But again, your number one goal is improve health. That's what we are also doing. We are health entrepreneurs. Now, as a health entrepreneur, I just mentioned, is a social impact. It's a social impact business, which means that unlike other businesses, whose number one goal is profit, our goal is what? Health. Impact, exactly, health. What we did is we looked at what impact do we want to make and decided to make a business around that. Instead of saying we want to maximize profit and what skills do I have in which industry that can maximize profit, is an opposite way of doing things, right? And that's okay, because again, our number one goal is health. Unlike other enterprises whose number one goal is profit. For us, profit and market strategies is a way to achieve the health. Is a sustainable way to achieve the health. Because begging and charity is not a sustainable way to do anything. The day the person begs for you or they broke, that's the end of your enterprise. That's true. And in Liberia, you know, with donor dependency, we talk about it all the time. Also in donor fatigue, I'm giving, I'm and I have other priorities now. My son needs emergency. I can't always solve your problem. You see what I'm saying? So you have to think about that. Also, that is why we said we want to use a sustainable way. We want to use market strategies. Please never ever forget. I'm going to keep reminding you because repetition is just best friend. Your number one goal is health. It's the health of your patients. The day you forget that, things will not go well. Why? Because even if, number one, if you forget that, it will impact the amount of effort that you're putting into it. Even if we're able to sustain your effort, a system's result is based on how it's designed. The way you design your system will determine the results you get. If you design your system to respect profit first, it will show. Your patients will know. Your customers will know. The people at the end will know. And that will not work. Because that was not supposed to be the goal. So people will know. Okay. I think I've talked enough about this. Number one, the goal is health. That is our number one goal, right? And I want you guys to keep that in mind. You need to know it and you need to understand it because you'll be faced with people who have a problem with the fact that they're using market strategies. People will say to you, because you are a for-profit business, it means you are greedy and it means that all you think about is money. But you need to know that that is not your goal. Otherwise, yourself will become ashamed and you become timid and it impact how you are able to really aggressively grow this business to increase the impact, right? If you say that you want to improve health and you are timid with your business and you don't grow your business, how big of an impact will you ever make in this problem that you're trying to solve? You'll be a small player. You will not be able to make a big impact. So if you're using market strategies, you have to expand as much as possible to get that reach to as many people as possible to solve the problem in as big of a way as you possibly can. So do not be afraid to grow. Do not be afraid to grow and do not be afraid to use market strategies. But remember, your ultimate goal is not the market strategies. Those are just what we're using to achieve your goal. Okay, now I want to talk a little bit about those market strategies. I know that's something that we're going to touch on, but I want us to get into it a little bit from a more health perspective and less from a business perspective. Number one, because I'm not a business professor, so I can't take it to you on camera. But market forces are very simple. It is demand from a customer and it is supply from a provider. Those are your two main market forces, right? You now, as the health entrepreneur, you are that provider. You are either providing, I don't know all of your businesses, so you're either providing a product or a service. It's very simple. Or maybe you could provide products and services. It's possible you do both. But there is a customer with a demand, and you, as an entrepreneur, have the supply. Now, who is the customer? That is what you really need to understand. Well, you should know your side of the equation. You are the supplier, you know what you are giving. I think that actually definitely helps you cover. You know what you are giving, either the service you want to provide or the products you want to buy. You know your side. You need to understand the other side. Who is your customer? It may come as a surprise to you, but the patient may not always be your customer. Your customer is the person who is paying. The patient may be the beneficiary, but it may not be the patient or the community member or person who have been public health businesses as well. The patient, I just use patient public health, but the patient, the community dweller, whosoever, may not be the customer, they may be the beneficiary. But the customer is their somebody that's taking care of them. Either their employer, their family member, their friend, a civil service organization who feels that this work is important, right? An insurance company that pays for the health insurance. Maybe one day a national health insurance team will be your customer, right? It is important to know who your customer is so that you can serve the customer and the beneficiary at the same time. This is extremely important. These are the market forces that you are using to solve your problem, to deliver health. These are the market forces we need to understand. We need to understand who is the beneficiary, and is the beneficiary the same as the customer? If they are not, what do I need to do about it? Right? So if your beneficiary, the person, let's say somebody is dealing with clean access to clean water for a community, maybe a borehole or water purification system, these are all public health things that could be based. So I don't know if maybe somebody is doing that. If somebody is doing that, let's say the community has 5,000 people. Those 5,000 people are not all the customers, they are all beneficiaries. But whoever is funding the project or the borehole is the customer. So now sometimes you have to think about two things. What does the beneficiary need and what does the customer need if they are not the same thing? And what service am I giving the customer and what service am I giving the beneficiary? In this example, the beneficiary is getting clean water. But if the customer is a child protection organization in the community, or let's say the customer is a church ministry that wants to provide, because I don't like to use, no offense to all of my donor partners, I don't like to always use donors as an example, because Liberians do things for ourselves, right? So let's say it is a church ministry that says we want to have clean water in the community surrounding our church, right? So we're going to find a company that provides clean water solutions. It may be a borehole, it may be water filtration, it may be any kind of, that is your customer. The beneficiary, I will put the community. What does your customer need? Your customer needs to be able to give them a plan, a product that's going to work, service that product later on, because the church will not come back and fix the borehole. That's not the area. That is right. So you need to understand who is the customer, what do they need from you, and what does the beneficiary need. These are your market forces. These are your market strategies. And the reason I'm really talking about the difference between a beneficiary and a customer, when it's simple and nice, when your beneficiary is your customer, that is easy. Because you know where the funding for your work is going to come from. So it's come directly from the beneficiary, but then also the customer. So that is a pay-for-service model. It's very easy. And that's usually what business people think about in enterprise. They're going to give somebody a service, they're going to give you money back. It's easy. But help, it's not always like that. Especially in a country like ours, where the majority of people who need help or help-related services are not the ones that can pay for it. So now you have to stand in the gap, as they say, to find out how to connect the customer to the beneficiary. Sometimes yourself will have to figure out a plan for how to connect these people who need it with the people who want to provide it. You see? And I said that because it impacts entrepreneurship. Some of your funding will come directly from a beneficiary customer, and some will come from a different customer. Don't forget that either. You have to think a little bit differently than your typical buying and selling industry would. Now, some of your business, maybe a pharmacy or a drugstore, where it's very clear buying and selling, but even those, people have insurance. You still have to understand that the person coming in to take that drug may not be the person paying you. And it helps you to know how to take advantage of that. For example, if you are a pharmacy, has anybody here ever gone to a pharmacy and used insurance to buy their medicine? In Liberia. In Liberia. Okay, one man in the whole room has been able to go walk into a pharmacy and use insurance to buy their medicine. But there are several insurance companies in Liberia. Tens of thousands of people on insurance. So imagine now if an insurance company, if a pharmacy thought about how to get in touch with those insurance companies and start to be able to accept that form of payment. All of these beneficiaries that will walk in, to them is free. They just walk in and take their medicine, and somebody is paying you on their behalf. So these are the reasons that I'm harping on this, because you have to think outside of the ordinary box sometimes. Okay, so let me go back to the original thing that I talked about, which is impact entrepreneurs are trying to solve a particular problem by using market forces, market strategies. Those market forces are demand from a customer and supply from a provider. You are that provider. Learn and understand who your beneficiary is and who your customer is. so that you can understand how to keep yourself funded to keep making an impact. But do not ever forget that your number one goal is health. Don't confuse yourself for a non-profit, and don't confuse yourself for a non-impact business. Neither of those is your area. You are right in the middle. You are using these market strategies to make an impact in health. That is what I have for you today. Thank you. But I'm happy to take some questions. I apologize I couldn't stand up the whole time. I'm using all of my force of my voice instead of my standing, but I'm happy to take questions.
So if we can just probably take 2 questions, please. Ask a question and give them back.
And I also have the first time if somebody doesn't feel comfortable sharing their question openly, I will give you guys some business cards you can contact me. And I have some flyers going around as well so you guys can hear about the clinic. Never miss an opportunity to share about what we're doing because we're doing things to help people, right? Finny is very good at that. He never missed an opportunity to talk about his business, so that's a good start. Questions?
It was a recap.
Well, I'm around. I will stick around for the networking session. If you want to ask a question one-on-one, I will be around. Thank you very much.
Thank you. And also thank you for just always trying to do your part of doing this project. I know she couldn't make it for the organization sitting now, but she would recommend somebody to be there, and that person came. That's just so important. I'm a special participants, most of all our attention very much for what we're about to have. I know we followed up with the minutes on the program agenda, and it's up already. We will be giving out the certificates, and we call out 2 persons to hand out the certificates. First, I like to call Dr. Bernice now, principal, because so, guys, don't worry. The certificates are just rearranged. It doesn't mean who's first or who's next. They all have the same wordings, and they all carry the same frequency measure. You can check that out there. Okay? So I'll just call their name, and then you come and receive the certificate. Johnson Bernard. Amos Medish Franklin. Mario Mantuzi Toure. Janet J. Doyen. Cynthia K. Jones. Patricia Zerdi. Safia Salut.
Yes.
Faculty actually. Easy family. Aaron Global Yasa. Samuel P. Morris. Thank you, Dr. Donald, for that character. Just to give up the and start with Yvonne Ticket. Lord, thank you for that. Elvin S.B. down. Joseph B. Jensen. Fatu A. Salif Mola. Flo G. Kalame. Akisa Bele. Augustina L. Appleton. D. Howard Bureau. Congo is Lila J. Clark. The last vocal is Kennedy Edward G. Thank you so much. You all give, thank you. We want to have some moment of reflection, especially from the Cohort members. So those of you who are supposed to be speaking, you can ask already, you can prep your have a meeting up here to express whatever you have to say to the program officials. So we appreciate that. If you look into the program, you're people. We have Aaron Dubayasa, Marion Tusi Touré. In the program is marvelous. Representative Touré, Lida J. Clark, and Fatu Obasoli. So in that order, we're going to begin, and I will be coming up here to begin with Healr Ideation.
Thank you so much. It was a great book. I was actually excited about what training. It's just like you are like your brain need revive, transform. At first, it was like, wow, 8 months. But unfortunately for us, we are done. And we are moving to a creation phase, hopefully. And I want to believe that all of us, having like picked our own time, I strongly believe that we'll move on to that next. However, I want to express my gratitude to our partners, the ULCHS, and now the ALA Liberia, because especially for the office hour, guys, the office hour actually convenient for us because after learning the theoretical aspect, we went to the ALA and it was quite wonderful. They exposed us to many things we use. At our time, our disposal, all of the page a year, it was due to a series of practice at ALA. The mentorship that was provided that was quite good for us to be able to implement this day today. So I want to express our thanks and appreciation to them. And I want us to know that upon the years, we have learned to only find a job. Our high school, our university days taught us to find a job. But within 3 months, we're trained to find our work. We're trained to find what makes things to happen. And you know, as one of our facilitators will say that your job is something you can retire from. Your job is something that you were trained to do. But your work is something that is part of you. It's something that you were born to do. It's something that nobody can take from you. So as we move on, I'm learning that I need to live my work and to do a job. So I'm trying to do a job. I think I am just to go to the on. I want to be that
Thank you to Ada. Thank you to my instructors, Mr. Daniel and Mr. Williams. On this program, one side, I had the knowledge on what leadership is, on how to structure a business properly, and on how to be able to craft my vision and translate. But for the course of 3 months, I've learned in depth what really entrepreneurship is. It's not just about making money, but it's about funding or crafting that crafting properly, finding a solution, and being able to present it to the audience so that it's not just they can get from the place, or for other systems for benefit individuals at the end. And also to my classmate, you guys did it was there before, but also very supportive. Thank you so much. Thank you to Minnie for your face of mistakes. Thank you to Beatrice. Thank you to Sarah for last day and this last year. Thank you to all of us for staying.
Over the past 10 weeks, I've been able to meet amazing people and I feel of them that when we travel to the children through our life. Notice that the first piece are the best piece. But this program is able to reach a group of children that are going to shape the children. Personally, for me, this program has the power to be able to reach the gap, and I want to believe this is a part of the reason why the team is not reaching to but, I want to take this time to say a big thank you to the civil team, the UR team, the vision team, the ULCHS team, our distinguished facilitators, and the other team. I've never worked in a space where I'm able to respect or facilitate us up to 19 and 20. As I was hoping the other team has been here, I want to doubt that there is no team that will have managed this project better than the other team. Let's go out, let's do this so that after that you'll come out, reach, and we say, oh yeah, and be proud of yours.
When you are almost there, you will give up. That's what I experienced at the time of the program. Just a few weeks to the end, I didn't think I would be sitting here today, seeing the many faces and appreciating our partners for taking up this goal, especially that Liberia has a full population. We thank you so much for bringing this dream. We hope that you will explore the opportunities where more young people can be represented and able to build our country. What we are learning today, we hope to carry out and be not just coming here to my colleagues who are very controlled, who are facilitators, all of the people who have been there supporting us and whom we go. You guys made this to be very successful, even though it was stressful or distressful, because you were there to support us and whom we go. Thank you very much.
Thank you. Thank you, Ideation class. I'd like to ask special remarks now. We've been having, the little pretty much sure who will be proxying or not for some of these people who will be making special remarks. So we'd like to begin with the Deputy Director for the Health Office at the University Education here in Liberia, Comprises.
Hi, good afternoon. Very happy to be with you all today. As I said, my name is Healr Ideation, and I work at the Associate Health Office here in Liberia. You're my colleague, Shelly and Cindy, some of you know. But we support Great View, we support the Center for Teaching, Learning, and Innovation, we support Dr. Cooper and the Healthcare Federation in Liberia. We support all sorts of solutions in the public sector, in the private sector, non-profit, for-profit, anything we can do to improve the health of Liberia. And I know all of you are really interested in engaging in that same work as well. Today, December 12th, is actually Universal Health Coverage Day worldwide. And we had an event at the Ministry of Health this morning talking about the importance of universal health coverage, the importance of making sure that every single person in this country, in this world, has access to the health services they need, quality health services, whenever they need them, and without it being a financial burden for them. And that's something we're really trying to improve here in this country. We know there are many, many challenges with that. We don't have enough health workers in a lot of cases. It can be hard to get health services out to remote and rural areas. We have problems with supply chain, so that sometimes people don't even have medications and commodities in the countries. They don't get to the people who actually need them. There are many, many challenges. And we were talking today about how problems are actually opportunities And if you look at it that way, there are opportunities all over the health sector. So it's really important to be having all of you here to work on these things. And I wanted to talk about a couple things in specific. One is just the importance of ideas. I know that you've all been through a course called the Ideation phase, where you're generating ideas. And it is so important to have people in this country who are going to look around, who are going to see things that need to be changed, and who are going to say, I have an idea to change this. I am the person who's the leader, and who will put the solution into practice. Having people like that is what this country needs. This is why we're so happy to see all of you here today, and see what you're going to be doing in the future. I also wanted to mention, USA, as an agency worldwide, is really interested in supporting local solutions and local people. There's an entire initiative called Localization, where we're trying to be able to direct more resources to go directly to local people like you, rather than to big international organizations. And in order for that to happen, there are some specific skills that people have to have. And this is why I want to encourage you all to pursue those specific skills. Dr. Dunn this morning was talking about financial reports. And often one of the reasons that it's hard for local, small local organizations to be able to receive funding directly from organizations like USAID is that we don't have the financial skills, we can't produce adequate financial reports. And I just want to encourage you to really learn in detail about financial systems, financial reporting, financial accountability, being able to demonstrate where money was used, being able to track and manage money. That is such an important skill to be able to work in this sector at all. The other skill that's really important is to be able to do research, to be able to understand data, to be able to identify a problem using data, and to be able to demonstrate that your interventions are contributing to solving a problem, again through data. So those are a couple of really concrete skills that you're going to want to learn to go along with your idea and your passion and your initiative to be able to take you forward. So we just wanted to say again how proud we are to be here, to have supported you, to be here to see all of you again today. I think we're going to really look forward to see what you're all going to be doing in the future. USA is going to continue to support initiatives like this. And I know one of my colleagues wanted me to share with you a Chinese proverb that says, when the winds of change blow, some people build walls, and others build windmills. So things are going to change. There's going to be winds. You can try to stop it, or you can use it as your strength and as your power for going forward. So the future is really up to you. Use your ideas, have some really concrete skills to go with those, and we will be here to support you. And we really look forward to seeing what you all have to do. Thank you very much.
Thank you. I didn't get the last name later, but Steve, but the chief nurse. Not here, right? Move on to the Ideation Course organization. All right. We'll take remarks and vote of thanks from Abu Chibu, who's the coordinator of Allah.
Good afternoon. Keep going to give it up for this young person. I feel so happy for these people. Back in June, we received 139 million of interest on 109. We selected today. Today we are celebrating the 24 persons. Guys, I think you did well. Before I let her remark, I want to recognize the staff of Healr Ideation. Staff, if you are yet to stand. No, we are very small team, but we are amazing things. So, in addition to our movement and the project director of Healr Ideation, my organization, I'm actually here to share with you a few stories of Healr, which comes from the things that we are going through. My organization was founded by a lady who came to work with Liberia back then in 2010. After a professional service in Liberia, she became passionate about the development of Liberia. Her passion was how she could help in the area of technology. She was also passionate about how she can introduce innovation program in Nigeria that can help young Nigerians to become their own job creators. How young Nigerians can become employers in their own businesses. And so, Healr was established to provide tech and innovation services or programs. Today, I'm here 10 years down the line as a messenger to bring the story of success. For 10 years, Healr has provided global standard technology to local international organizations who have come to work in Nigeria and need modern technology to support their work. That's why we have been doing since 10 years. We have worked with universities, the government, philanthropists, and just everyone who is participating in the development of Nigeria. 10 years down the line, I've come to tell you that Healr has been involved in helping young people to become entrepreneurs. Today is just an example of some of the things that we have been doing. And so we are so grateful for the Bridging Project, your university, particularly in the University of Liberia, for this creativity to introduce entrepreneurs, but this time in the context of health. The programs that have been introduced in Nigeria, that have been working in Nigeria, has been just across all the sectors. So for the Bridging Project, it's so unique to health. And that's something we at Healr, the board, the management team, and the staff are so passionate about. We are happy to be part of it. That today we can be able to be part of a success story, producing for the first time in Nigeria, help entrepreneurs who will contribute to the development of the health sector in this country. We are so glad. On this note, I've been asked to also make a little thanks. I want to say thanks to all the stakeholders that are involved or has been part of this process to get today being successful. I want to single out the USAID and the American people for supporting such initiative. We want to be with you. Please don't get out of Liberia, especially our health sector. Some of us who are there, who have had joining in the health sector, we know how challenging the health sector is. We are glad you're supporting this initiative. To tackle that, I want to say the story of Bridging, that you started the design and today is where it is. Same people that can take more water and bring more programs to Liberia and particularly to Southern Nigeria. To the partners, CIMET, they are the consortium for improvement of innovation technology. They are here in the US. They are the one who designed this program. And in ourselves, Nigeria, we also there in local aspect of what the design is. We engage people, reach out to them, and ensure that they can't take the of what you see here today. To the Bridge project, I started the project management team, headed by Chelsea, Sister Madonna, Development University, the University, I want to say thank you. I know you are passionate for a part or any hundreds of message. We appreciate your technical and administrative support. And to our guest speaker, like the previous speakers of COSE, to get the approval, you have to read a walk. Calls, and literally walk for all the beautiful times just together. So thank you for coming for honoring our invitation. Thank you to Dr. Landro, folks. Jenny, people from the NDL, the rest of the project leaders, thank you for coming. And as I just see somebody singing. All right, yeah. So we are very proud of this thing. We all started together with design and till now. We're networking. So thank you for coming. Harry was here. She's not here. And then to our facilitators, William and Dennis, Joseph, Maxwell, Daniel, and then Joe. Thank you for the effort towards these students, these participants. I think knowledge has been well gained, and we hope that as you live here for them today, please use the knowledge wisely. Tomorrow we will see you, see a big flying high, just as we are seeing today, with the Cohort being one day. Forerunner when it comes to without entrepreneurship this one day, please be at the number years to come. On this note, I want to say thank you all, and I turn over to the MC.
Thank you.